that we've got to take action for anything to change, right? If we want to make changes in our life, we've got to take responsibility and take action for it, right? And that's what tonight is all about. Tonight is about the actions that you've taken to be here, to listen, to start to shift your mindset towards health, right? Because if we continue to do the same things that everyone else in America is doing, we're going to continue to get the same results, which is top 3 lifestyle killers in the United States of America. The top 3 diseases are lifestyle killers, right? And that means you can unlifestyle yourself out of that problem and avoid it at least 95% of the way. Which, who wouldn't want to do that, right? And if you can avoid that, that's our goal, right? So tonight is all about shifting that mindset, shifting your mind, and your actions will follow. Let's see here. Boom. Okay, beautiful. All right. So the first and most important question is, what is health? Yes.
Something about your body.
Right, something about your body. Right? Yep, exactly. Right? And most people in the United States of America, when you ask them what is health, they're going to tell you something different. Most people tell you health is how you look or how you feel. Right? I'm healthy if I look good, or I'm healthy if I feel good, which isn't necessarily the case, right? Does anybody know who these people are? Patrick Swayze and Farrah. Yep, famous people. Patrick Swayze and Farrah Fawcett. Would anybody disagree that those people look good? Right? Exactly. Look good, feeling good, ought to be in Hollywood, right? Do you know who this is?
Is that Farrah Fawcett?
That is Farrah Fawcett. That is correct. Right? And that, as you would have probably guessed, is also Patrick Swayze. Now, they died from cancer, right? But would anybody disagree that they had all the money in the world to afford the best doctors? They had the money for the best chefs in the world. They had living chefs to cater food for them, but they still suffered from what? Disease, right? And it's because they didn't know what true health was and where it came from. The doctor of the future, the doctor of now, will interest his patients in the care for the human frame. Take care of your body will be good to you, right? That's the most important thing. And health is not how we look or feel, right? Exactly like you guys said, health is more than that. Health is a state of complete physical, mental, and social well-being, not merely the absence of disease, right? And definitely not just the absence of pain, right? And insurance likes to go after the keyword pain, right? But hopefully I'm gonna shift your mindset tonight to allow you to look at health in a different way, so that you understand pain is not what we want to focus on. So if health is not how we look or feel, it's how we function, right? That was the key word in the phrase before. Function, right? So if health is how we function, we've got to look at what controls all function in the human body. You know what that is?
The nervous system.
Exactly, the nervous system. Your brain connects to your spinal cord and actually becomes your spinal cord. Those life messages, those signals of healing, health, function, moving, thinking, speaking, eating, digesting, all those powers come from the brain, which creates that impulse, goes down the spinal cord, that goes out to all your organs, cells, and tissues in your body at 100%, and tells your food how to digest itself, right? We'll get questions afterwards, I promise. Save them. So the major premise is that the quality of healing, the quality of your life, the quality of your function is directly proportional to how well your nervous system works. Does that make sense? Yes or yes? Right? Exactly. So, your nervous system controls everything. So we want to look to the nervous system when we're dealing with function. And back to that slide before, the This was a palace in Brazil, right? The way it was built, its structure was built poorly. Fortunately, nobody died, but this palace just instantly collapsed. And the reason why is because when they built this palace, they used horrible materials to build it. What they did was they cut costs. The way they cut costs was they used sand instead of fully using cement in some cases, right? And so what happened was the engineers obviously got in a lot of trouble. Thankfully, I believe no lives were lost. You might have to fact check me on that one. But the point is, if you use poor quality things and try to cut costs on your health, let's say eating McDonald's because it only costs $1, right? Instead of investing in healthy food, organic foods, whole foods, things that will nourish your body, allow your body to heal, and you think cutting those costs up front is going to help you in the long run, it's not good. So your innate intelligence is that brain communicating with the spinal cord, sending those signals throughout all of your body, right? This is what your nervous system looks like without all the muscle and tissue in the background. And this is what we work with as chiropractors, doctors of the spine. So these are a couple of pictures of what happens when you take that function and start to interfere with it, right? If you take that spinal cord and you start to compress those discs in your spine, that starts to make those holes that the spine, that the nerves come out of, it starts to compress them, right? The joints compress, you get restriction. You shift your head forward, you're going to start to compress not only your spinal cord, but these nerves that exit, right? And then what happens? There's nerves at the end of these organs. You might feel pain, but more likely than not, you won't. Because only 6 to 8% of what your nervous system will pick up has anything to do with pain. How crazy is that, right? You could have a disc or a fracture in your spine, and you might not even feel the herniated disc, right? Over 60% of people that have full-blown herniated discs don't even feel it at all. Right? But once you start to interrupt that flow from your brain to those organs, you start to get problems. You start to get dis-ease or disease, right? And unfortunately, in the modern healthcare system that we have, you don't necessarily know what to look for, because if you're not feeling the pain, how are you going to know that your organs aren't functioning well, right? Until they're so diseased that then you have stage 4 cancer, or the first symptom of a heart attack in over 85% of cases is the heart attack itself. But if you ask the person who had a heart attack the night before if their heart was healthy, what do you think they would say? Yeah, exactly. I'm fine. I feel good. I look good, right? So the key word you want to understand in our world is a subluxation. A subluxation, you've heard of a dislocation. A dislocation is when you take, let's say, your arm and it fully pops out of the socket, right? You dislocate your arm, your shoulder, your elbow, something, then you put it back into place. In the spine, you have less than a full dislocation. It's called a subluxation, right? Now, what can cause your spine to malfunction or distort and create those subluxations? Well, thoughts can, right? If you think if you're going to work and every day that you go to work, you're stressed out because your boss you got a deadline coming up, right? And you keep doing that day after day after day, you're going to create physical responses. Your hormones are going to start to kick off and release, right? And they're going to stay that way, causing chronic cortisol release, right? Which causes a lot of stress to your nervous system, and then eventually your stomach will not digest food properly, right? That's just one of the side effects. You can definitely cause subluxations with trauma, right? If you get hit in a car accident or a car crash, or let's say you're playing sports, you get some type of trauma, that's going to cause an issue affecting possibly your spine and nervous system. And then if you don't fix that, let's say you roll your ankle too, if you don't fix that, your brain rewires that, right? Now you've got a neurological miscommunication, misfiring, and that causes a lot of problems, right? It can also cause subluxation from traumas. I mean toxins. So eating poorly, right? Obviously if we eat McDonald's all day, every day, that's going to cause our digestive tract to fail. So the next thing I want to talk about is what happens and how do you know when these issues are going on. So it's much like a car. If you saw the check engine light coming on, would you just put duct tape over it? No, right? You wouldn't put duct tape over it. Why?
That's not going to solve anything.
Exactly. So unfortunately, what happens in our times now in America is when you get a disease or a pain or a crisis, what we tend to do is take medications for it. Hey, I have pain in my back, let me get a cortisol injection. Or let me get a nerve ablation, where they just cauterize the nerve. How is that going to fix the problem? It just took away, it didn't even take away the pain, realistically. What it did was, it took away the nerve, now you can't feel the pain. So whatever's causing the problem, you're going to continue to do it and not feel it, you're going to continue to worsen the problem, right? So unfortunately, the last thing we want to do, and the worst thing you can do statistically, medically for your health, is to try and mask a pain with a pill, right? Here are some warning signals: neck pain, back pain, sciatica, acid reflux, high blood pressure, right? These are some of the things that can start to occur in your body that instead of thinking, I need a pill or Tums for my acid reflux, instead what we should think is, is there something going on with my spine, right? How well is my brain communicating with my body, and why is it now causing this symptom to occur that we call acid reflux? Something's not working because I didn't have acid reflux when I was born. Why is it now all of a sudden causing me problems, right? So here are some of the warning signals. If you see someone walking around like this, or worse, you see kids walking around like this, texting on their phone, they're going to get forward head posture, or what we call text neck, right? Or even tech, like technology, tech neck, right? If your posture is altered, that means that your true posture is altered. I created the word true posture to mean your spine. Because if you're walking around like this with one shoulder higher than the other, or your head's forward like this, there's something going on with your spine, right? There's a reason why it looks like that. And that's why we check posture as well, right? X-ray warnings. So that's why we like to take x-rays here. We like to get a baseline of where your spine is currently, so we can see, is it healthy or is it unhealthy? Is it normal or abnormal? So that's your spine from front to back. It should be straight up and down. That is a healthy spine. That, would anyone disagree that this is unhealthy? Right? No one's going to disagree, right? That's a scoliosis, right? The most important thing you can do is to start to correct that. Not just wearing a brace, because a brace will not correct it. It may potentially prevent it from getting worse, but realistically, it won't really even do that. So there's a what is close to a healthy curve of the neck, but that would be with this person looking straight forward, but that's the person bending their head backwards, right? And this is them bending their head forwards, which should look close to that, except in the reverse direction. So this is why we take x-rays, is so that we can see, are these joints, these vertebrae moving correctly? And if not, where are these instabilities occurring? Because wherever there's an unstable joint, like this one, the nerves that come out right here, and right here, and right here, could be being affected. And that's what we're checking for. This person most likely has thyroid issues, energy issues, because those nerves that exit right here control the thyroid. They also control a lot of other things. And as you get further down the spine here, you're talking about arm innervation, where nerves go to the arm, so you could lose grip strength, hand strength, you could have poor circulation. Because you got to remember that even though the heart is usually what we think of when we say circulation, you still have smooth muscle inside your arteries and your vasculature that have to open and close, and guess what controls how much they open, how much they close?
Your nerves.
Your nerves, exactly, right? So often I get asked by my patients, okay, this makes so much sense, why didn't my doctor ever tell me about this? Well, I'm going to tell you that they did learn about it. In fact, here are the medical textbooks that we used in our school, and that every single medical doctor and osteopathic doctor uses in their school. They learned the nervous system. They just didn't look at it the same way, right?
That's disappointing.
It's interesting, right? So often I get told, or I hear it's really a complaint of anything, is, oh, well, I can't do anything about this because it's in my genes. Obviously not your genes like that, but in your genetic genes. Now, while that may be true, what we're finding out now with modern research is that there's something far more superior than your genes. It's the expression of the genes. Epigenetics. You can turn on and off certain genes based on your environment, based on what you do with your body and how you interact in life. So we have far more control than we've ever been led to believe. So why would you get adjusted? Well, an adjustment is putting the spine back in its normal alignment, back in its normal place. That's why you get adjusted, right? Because you want your spine to be healthy so that your organs can function healthily, so that your body can function healthily, so that you can think clearly, so you can do all those things, all those goals you set down the road. One of the goals that I never, in all the talks I do, right, whether it's a church organization, whether it's at work, whether it's here, whether it's at a CrossFit gym, I have people write down their goals. No one ever writes down as one of their goals to be in a nursing home.
Yeah.
But would anybody disagree that nursing homes are completely filled up?
Yeah.
Right? People are fighting to get into nursing homes. And does anybody have any idea how much they cost?
My grandfather pays like $4,000 a month.
$4,000 a month. That is the lowest, and that's actually the lowest I've ever heard. The average is $7,000 to $8,000 a month,
Wow.
and way beyond that if you want to get super ridiculous. That's a lot of money to pay to have a really poor quality of life.
He had a great life, had a great savings, and
Yeah.
it's gone now.
Yep, exactly right. And that is not what his goal was. There's no way anybody writes that down. So if we don't change something about how we view health, we're going to end up just like him, just like my grandfather. And that's part of my story is my grandfather's a medical doctor. He passed away as a vet in a veterans nursing home, assisted living facility, and he died from bed sores
Oh my
and
goodness.
complications of. That's horrible.
That is.
So your spine, just like anything else, is something you want to invest in, right? You brush your teeth daily. Why?
Keep him healthy.
Keep them healthy, right? Keep them healthy. Prevent gum disease. They're not in pain. Why are you brushing them? Right? Because you want to prevent anything from happening. Right? So it's the same thing with your spine. Actively take care of your spine. Invest in spinal hygiene. That's why we're so adamant about doing the therapies that we have here. Because as you're getting adjusted to correct your spine, you've got to be doing things that help strengthen and stabilize your spine to keep you healthy for life, right? And as you correct your spine, part of the goals and the requirements as a patient in the office are that you promise us that you're going to maintain all the correction you get, that the money you've invested in, the time you've invested, right? This isn't just a one and done thing, right? We're teaching you how to take care of your spine. And it's far cheaper to take care of your spine now, and you can live a good high quality of life, and you can go on vacations on your own money and not spend all this money in nursing homes versus a spine surgery, which costs close to $100,000 or more depending on the surgery, and usually after repeat surgeries, right? So it's way less expensive. It's not even expensive to maintain your spine versus wait until something bad happens, right? Just like you would put gas in your car or change your oil in your car. You don't wait till the engine blows up, right? Well, some of us do, but. So the arc of life is extremely important. That's the upper cervical curve in your neck. This is just another example of instability, and this is using an X-ray. Kyphosis, or that loss of curve in your neck, takes up to 15 years off of your life. Several medical journals have studied that across the board. Even the Journal of American Geriatric Society talks about that, the Journal of Spine. If you've lost that curve in your neck, it is extremely important to put it back in your neck so that you can have a high quality of life. In a very cool, interesting study, and I have a bunch of studies here that I came prepared with, that talk about things like multiple sclerosis, Parkinson's, and patients that go through chiropractic care actually correct their spine, and guess what? They're healthier, right?
So that eliminates the lesions on our spine? Or?
So definitely helps with it, right? And there's a lot of, you can't say that that every single person is going to get 100% better. Nothing is. But it is far more effective than anything we've got out there right now. Promise you that. And less invasive. No side effects because it's not a drug, right? Because man recovers twice from American medicine. Once from the disease, once from the drug, right? This is an example of healing times and why it takes time to heal your spine, right? It could take a year, 2 years, sometimes closer to 3 years, depending on how much degeneration is in your spine. That's why we teach you how to take care of it now and for life. Degenerative changes in just 72 hours with ligaments and tendons in the spine. Decrease in protein content, but in just 96 hours, right? So these are some of the things that happens when your spine is unhealthy, when your ligaments are unhealthy. This right here, what they're talking about, are joints in your spine. The most important joints in your spine, potentially, your facet joints. Ulcers penetrating the bone in just 90 days. These are how fast changes will occur. That's why if you get in an accident or a crash, and you know someone got in a crash, get them in here. They've got to start taking care of themselves because changes occur extremely fast, right? The better news is you can also reverse them, but that's only if you know what to do, right? So here is a very important video. And the only thing on this video, this is not age related. That's the most important thing to recognize from this video. This has nothing to do with age, it has everything to do with posture of the spine.
Is that the neck?
That is the neck. And you notice all these bony changes that are happening? That's because this person's lost the curvature in their neck. Again, nothing to do with age. Right? It's extremely important to walk away with and truly understand that. This is an example of one of the patients. Multiple sclerosis, neck pain, headaches, high blood pressure, dizziness, heartburn, numbness and tingling in the hands, feet, fatigue, 9 medications. Does anybody know what the average number of medications somebody's on?
Oh, maybe like 6.
Yep. So that was a really good guess. So the average right now is 12 to 14.
Wow.
It's actually probably higher, to be honest with you. This person on 9 medications. 6 months later, off their multiple sclerosis medications, off the blood pressure medications, and the heartburn medications, walking better, not on a cane, night and day energy level differences. Why? Because look at their neck. Remember I was talking about that through the x-ray report? Right? Brainstem right here controls sleep-wake cycle, immune function, right? There's a reason why Dr. Chris and I don't get sick, yet we see all the patients. Why are we never sick? If it was true that you caught sickness and disease, then we would be sick all the time, right?
Yeah.
Why does that not happen? Why does that not happen with my colleagues either, right? The ones that take care of themselves. The 5 foundations, right? Thoughts, toxins, trauma, function, food, fitness, filters, and freedom, right? The more you invest in your body, the more your body will invest in you. And as a very cool byproduct, she also lost weight. They didn't change her diet. Would we encourage changing your diet? Absolutely. Everyone knows that when you eat healthier, your organs function better. You're gonna have a better quality tissue, right? Instead of that structure that was made completely of sand and some cement, you've got, it's like the 3 Little Pigs story, right? Instead of making a house, would you rather make it out of straw or brick? Brick, right? It's way stronger. When you eat healthy, your body has to fight off less toxins and traumas, right? Definitely adjusting kids. Does anyone want to guess when the first time a subluxation or an issue in the spine can occur?
Probably childbirth.
Exactly, right? The way we do surgery now in America, they use a lot of forceps, vacuum extraction, even just the baby's not turning over correctly while they're being born. And a lot of pregnant women, we see a lot of pregnant women, why? Because they want to keep their hips healthy, keep that structure healthy, so the hips move the way they're supposed to, so the baby can turn in the womb, right? Then it doesn't get stuck when it's coming out. And the average birthing time, I believe once the water breaks, is like 2 hours. I don't know what the average for a typical American birth is. I want to say like, do you know what it is?
I don't know.
14 hours, 18 hours, 20
Probably
hours?
something like that.
Something crazy, like it's 2 hours for those that are actually in chiropractic care.
Oh, wow.
True chiropractic care, not going in once a month because insurance pays for once a month.
Yeah.
Insurance doesn't pay for anything that's important.
That last one that you were
Yeah.
looking at, the SIDS, that is
Sudden infant disease?
interesting.
Yeah, absolutely. This was a German doctor too.
Wow.
It was, and in fact, I started reading it because I can read German. It's all in German, his studies are all.
It's interesting
Yeah, very interesting, right? Check the spine. It's our lifeline, right? Here's another example. This was a kid. Most kids don't walk around having pain, but if they do, that's even worse, right? This was a 6-year-old taking Ritalin. Now, I don't know where people's stance are on medication and drugs and pharmacology and things of that nature, but it's kind of hard to believe that any 6-year-old truly needs to be on an ADHD medication or Ritalin. I think that's not letting the body do its thing. That's for another story. They're off medications. This kid also was not in pain. That's the most important part here. That even though they had a straight neck, they weren't in pain, right? They were wetting the bed, off of their medications in 3 months, less bedwetting. That would be awesome if you were a parent. No bedwetting and still no meds after 9 months. How awesome is that?
That's
right?
awesome.
That's just one of hundreds of examples. So spinal hygiene, why invest in your spinal health? Easy. It's like a Vitamix. Have you heard of a Vitamix blender? You have?
Yeah.
So they're powerful blenders. If you just use the Vitamix to, let's say, make Kool-Aid, could you do it for that?
You could, but.
You could, right? But what if you knew your Vitamix made nut butters and soups and whatever else you can make with them, right? You get so much more use out of it, right? That is what we're trying to show you and teach you about with your spine and chiropractic. You get so much more benefit once you know what your spine does and once you know what taking care of it does, right? 200% stronger immune system than those not receiving adjustments, 400% stronger than those with chronic illnesses. Again, back to why Dr. Chris and I are never sick. Wellness chiropractic patients spend 70% less on healthcare, 85% less drugs, 62% less surgeries, 60% less hospital stays. That in and of itself would well over probably 5 times pay for any investment you made in this office, right? Let alone less than 1 month in a nursing home, right? Even at just $4,000. 90% of stimulation of nutrition to the brain is generated by what? Spinal movement. And not just spinal movement, correct spinal movement. I see a lot of people who do yoga. They have flexible spines, but too flexible spines. Meaning, just like that picture we saw earlier, there's instability in the spine, and they become hypermobile. Not moving enough, having stiff neck, restricted range of motion, is just as bad as having too much in certain areas, right?
I didn't know that.
So it's all about the investment. What else do you invest in? You eat healthy. Why? To make sure that you're healthy, your digestion's healthy, your nutrition's healthy. You have a good quality foundation. You have that brick house, not the straw house, right? You pay for oil and gas. It's far cheaper to pay for oil and gas and maintain your car than it is to pay for an engine, all right? Especially depending on which car you have. You work out to stay healthy. You don't wait till you're in pain to work out. And actually, here's another cool thing. When you're working out, you don't go in there thinking, oh, I'm not going to work out because I'm not going to struggle a little bit or sacrifice a little bit. Or you actually go work out and knowing you're going to be in pain, right? You go knowing that you're going to be stretching your muscle tissue and building up toxins. And you feel good afterwards. But you do it anyways, right? It's the same here. That's why we talk about, in the beginning, we're not going to ask about pain. Why? Because when you're correcting the type of spines that we see in this office, it's going to take time. You might be a little bit sore with your exercises. That's a natural, normal response, right? You also want to invest in date night. I'm 70% into our marriage. They're going to be 100% out, right? You invest in the things you want. So this is extremely important. Spread the health. How many people have learned something tonight that they didn't know before? Right? Exactly. Right? So it's about telling people, right? I love nutrition. I'm extremely passionate about nutrition. My whole life story, which I didn't get to tell you guys about, started with nutrition. I know how important nutrition is, but I'm not going to tell people about nutrition as the first thing out of my mouth because you hear it everywhere. Fox News, CNN, everyone knows that eating better is going to help you out, right? You're going to be healthier. I'm going to tell you about the spine. If I have 30 seconds to impact your life, I can do it the most by telling you about your spine and how to take care of it, right? So spread the health. Tell people to get their spine checked. Tell people the importance of their nervous system and their brain. People at work. Everyone has that, we'll call her Sally, right? She's in the cubicle, two cubicles down, and she's always sick. Tell Sally to get her butt in here, right? Not only that, but you want to be healthy too. Not that you're going to catch Sally's sickness when you're healthy, but it's less toxins and traumas that you've got to worry about. Your body fighting off, right? So if your workplace doesn't look picturesque like this, it looks more like my workplace. I'm just kidding. I always say
I've
don't
never
let,
seen it look like that either.
I always say don't let Dr. Chris do that one. Speaking of which, my patients, Dr. Chris's patients, we attend a lot of seminars, a lot of advanced, I'll get right to you, a lot of advanced techniques and business building things. So you might be getting adjusted by Dr. Chris or vice versa. I might adjust Dr. Chris's patients when he's gone. You're in good hands. Obviously, that's who adjusts me, and I'm the one who adjusts Dr. Chris. And we practice the same techniques, right? Or if you're thinking of a loved one, a family, someone in here who you know is taking allergy medication because they constantly get sick with seasonal allergies, let them know to come in here. Boost your immune system, and your allergies are going to go way down, right? I hear that often. People are like, oh, this area is so bad with allergies. How come I never have allergies no matter where I travel? I've been around a lot, right? From school, from Pittsburgh, Pennsylvania, to Atlanta for school, to Texas for residency, to here. Like, I never get sick with allergies, no matter where I go. So this is the picturesque family, right? Or my family. No, I'm just kidding. So if you know somebody in your family that could benefit, tell them, right? And Dr. Chris and I do the same thing. If it's an immediate family member, like let's say it's your daughter or your son, we'll get them checked out on us. If it's someone at work that you know, everybody gets a golden ticket. It's like Willy Wonka and the Chocolate Factory. That golden ticket, save that for somebody that you know that will take action, right? Because that's going to give them a complimentary exam on us. That means we take care of everything, right? But you only get one of those. But your family, bring in your immediate family within the first couple of weeks, and we'll get them checked out. Last and most important thing, teamwork. It's a doctor-doctor relationship, right? I do my part, you do your part. Together, we're going to help you reach your goals. We're going to help you get off the medications, working with your doctor, right, your primary care doctor, if that's your goal. We're going to help you get back to exercising and working out, as long as we follow the ABCs, right? The ABCs are adjustments and rhythm. Make sure you're consistent with care. You're going to see the most benefit the fastest when you stay consistent with your care. You're going to start to hold your adjustments longer, right? You're going to see amazing benefits, and it takes time, right? You don't go work out at the gym 3 days in a row and then just stop for 4 months. And then, oh, why didn't I put on 30 pounds of muscle or lose body fat, right? That's ridiculous. You want to stay consistent with care. Breaking bad habits. That's what we teach you. Don't sleep with 6 pillows like this. Or if you're like my mom, I always throw her under the bus, just as a joke, but she likes to sleep on the couch like that. All the way back in Pittsburgh, Pennsylvania. Doc, I don't know what I did, or I don't know what happened. I think the adjustment you gave me, my neck's hurting a little bit worse. Well, you know what? It's normal to be sore after the first couple adjustments, you know, especially as we're progressing through care, especially depending on your x-rays. But when we're asked, well, how did you sleep? Did you sleep funny? Did you do anything different or weird? And inevitably, you guys all say, no, I didn't do anything weird. But that's how you slept. Right? So just be conscious and aware of the things that you're doing on a day-to-day basis so that you know things that you can modify to help yourself out. Like a lot of people in here have desk jobs, right? If you can take a wobble disc, a wobble cushion, take it, get one, take it to your work, sit on it and use it. Be very conscious of your posture so that you're not sitting like this at the end of the workday, right? Because the most common cause for subluxation, does anyone know what it is? It's not sudden impacts or like a fall from 12 feet or a car crash. The most common cause of subluxation in your spine is actually chronic, repetitive poor postures. Right? So things like this. Somebody who's at a desk work job, that's how they get that dowager's hump. You see those people walking in the store like this?
Yeah.
That's what it comes from. They also didn't wake up with a goal to look like that, right? We want you looking good in your glory years, right? Or from birth to school and the whole 9 yards, right? Also, make sure you do your exercises. Extremely important to care, right? Your exercises are going to help as we're remolding and remodeling your spine. Your exercises and orthotics are going to help take your scar tissue that you've progressed and formed over the years to whatever your spinal alignment is. Scar tissue looks like that. Normal, healthy tissues look like this. So our goal is to get you back to this as close as possible. Right? You might not be able to perfectly get back to normal, but we're going to get you as close as we can and work on stabilizing that spinal structure. That way you can continue your spinal hygiene, and once you are stabilized, you move into wellness care, which is where you're here a lot less often, but you're doing your spinal hygiene stuff at home a lot more, right? Again, doctor-doctor relationship, right?